I wanted to start with the response to the pandemic. I mean, you've thought, I think, more than pretty much anybody about pandemics. You've warned about them for years. You've advised countries to prepare for them. Has this response been better or worse than you expected?
Well, certainly we didn't get ready. We didn't run the simulations to realize, okay, getting testing up quickly would be important. So we failed before it came along. Well, certainly we didn't get ready. We didn't run the simulations.
On October 18th last year, Johns Hopkins Center for Health Security, in partnership with the Bill and Melinda Gates Foundation and the World Economic Forum, conducted a pandemic simulation exercise. Named Event 201, the exercise simulated the outbreak of a novel coronavirus, modeled largely on SARS, with no known vaccines. From bats to pigs to people, the hypothetical pathogen was assumed to be efficiently transmissible with mild symptoms in a community. Event 201 was run by the Johns Hopkins Center for Health Security in partnership with the World Economic Forum and the Bill and Melinda Gates Foundation. It invited people from business, government and public health to simulate coordinating a policy response to a theoretical pandemic. Bill and Melinda Gates Foundation cited several partnerships and contributions to pandemic preparedness that had increased since the 2014-15 Ebola outbreak. Among them, the foundation stated it has supported efforts to bring more coordination and transparency to international collaboration on pandemic preparedness through other platforms, including the Global Preparedness Monitoring Board, GMBP, and the Johns Hopkins University Center for Health Security. Needed to be said that Bill Gates has been vocal in the past about the threat a global pandemic poses to human civilization. In a March 2015 TED Talk, Gates argued, saying that if we start now, we can be ready for the next epidemic. During a Vox interview in May that year, Gates also said that the Ebola epidemic showed me that we are not ready for a serious epidemic. In a February 28 article for the New England Journal of Medicine, Gates wrote, saying, "In the past week, COVID-19 has started behaving a lot like the once-in-a-century pathogen we've been worried about. I hope it's not that bad, but we should assume it will be until we know otherwise." While the event didn't predict the current coronavirus pandemic, it did point out how unprepared the world was to control such disease. This was the purpose of the roundtable exercise. After the event ended, the organizers released a document of recommendations explaining how these conclusions would require collaborative efforts between governments, international organizations and global business, as these further decisions would reduce long-term effects and consequences of a global emergency.
Well, certainly we didn't get ready. We didn't run the simulations to realize, okay, getting testing up quickly would be important. So we failed before it came along. So that day we sat there in early March and said, okay, no one comes to the foundation offices, and they haven't been since. We were talking with Microsoft about it, and they did the same thing. I remember thinking, gosh, I wish we did practice for this.
I remember thinking, gosh, I wish we did practice for this.
Because it's such a novel idea.
The
Event 201 scenario is fictional. Today's scenario is going to simulate meetings of a multi-stakeholder group called the Pandemic Emergency Board.
We're at the start of what's looking like it will be a severe pandemic. We're at the start of what's looking like it will be a severe pandemic. And there are problems emerging that can only be solved by global business and governments working together.
There's been some conspiracy theories that are around about the potential that pharmaceutical companies or the UN have released this for their own benefit.
And maybe this is a time for us to showcase some cases where we are able to bring forward some bad actors and leave it before the courts to decide whether they have actually spread some fake news.
A new coronavirus. Infected people got a respiratory illness with symptoms ranging from mild flu-like signs to severe pneumonia.
In related news, a significant demand for personal protective equipment like N95 masks and gloves are on the rise. Patients are overwhelming healthcare facilities. People are avoiding public spaces out of fear of infection and in compliance with public health recommendations. Our U.S. affiliate has just released polling results on public expectations for a vaccine, and 65% of those polled are eager to take the vaccine, even if it's experimental.
I am not optimistic about having a vaccine in time to be relevant during this pandemic.
With enough money and political will, anything is possible.
Penalties have been put in place for spreading harmful falsehoods, including arrests.
If the solution means controlling and reducing access to information, I think it's the right choice.
What exactly are the risks and benefits of staying home from work? Absolutely, we need to save lives, but we literally cannot afford a heavy-handed response that suffocates our economy.
The world saw large-scale protests and in some places riots. This led to violent crackdowns in some countries and even martial law. The public lost trust in their respective administration. Economists say the economic turmoil caused by such a pandemic will last for years. The societal impacts, the loss of faith in government, the distrust of news, and the breakdown of social cohesion could last even longer. We have to ask, did this need to be so bad?
I remember thinking, gosh, I wish we'd practice for this because it's such a novel idea. And then once it hit, we also made some mistakes. So once it hit, we also made some mistakes. So overall, I'd say the response has been less good than I expected. Less good than I expected. The damage economically and health-wise has been far greater than I would have expected with a virus like this. Well, certainly we didn't get ready. We didn't run the simulations to realize, okay, getting testing up quickly would be important. So we failed before it came along. I remember thinking, gosh, I wish we'd practice for this because it's such a novel idea.